Hi, I'm Lancelot Pinto. I'm a chest physician at the PD Hinduja Hospital and the Hinduja Healthcare Hospital at Khar, Bombay. I'm a respirologist by training and an epidemiologist as well with a keen interest in tuberculosis. Let's now talk about a complex case of tuberculosis that I saw a few years back. This was a 29-year-old lady in Jan 2013 presented with fever, cough and weight loss to her general practitioner. Her sputum was AFB1+ at that stage, and she was started on first-line anti-tuberculous medicines. She developed drug-induced hepatitis within a few days of starting the medicines, and this was a turning point for her in terms of treatment. The treatment initiated was adequate and appropriate. However, when she developed drug-induced hepatitis, the general practitioner was not very familiar with managing it, and he switched her to ofloxacin, ethambutol, and streptomycin, and then stopped streptomycin after 2 months, subjecting her to just ofloxacin and ethambutol for the next 7 months with a total duration of 9 months of therapy. Her symptoms, however, persisted during the course of the treatment, and she switched physicians and was started on suboptimal doses of kanamycin, moxifloxacin, ethionamide, para-aminosalicylic acid, and ethambutol. No diagnostic tests were done even at this stage, and she then consulted me in September 2014, and we did a smear which was 3+ at this stage, suggesting that her bacterial burden had increased significantly. We did a line probe assay, and I must mention that the line probe assay is also available in the public sector, and I would encourage you to refer patients to the public sector to do a line probe assay if affordability is an issue. So we sent off her sputum for a line probe assay, and she turned out to be resistant to everything except an injectable. We started her on an empiric treatment of kanamycin, high-dose moxifloxacin, linezolid, ethionamide, cycloserine, clofazimine, and para-aminosalicylic acid. Her drug susceptibility profile was available after a few weeks, and it showed that she had a pre-XDR pattern, which is resistance to the first-line drugs, that's isoniazid and rifampicin, in addition to resistance to fluoroquinolones, which makes it a pre-XDR pattern. An XDR pattern would imply resistance to an injectable as well, but this lady fortunately had a strain which was susceptible to injectable medications. In July 2014, her chest radiograph showed a cavity in the right upper lobe, and we considered a lobectomy at some point of time eventually. After 4 months of treatment with second-line drugs, her sputum was negative for AFP for the first time, which was a very positive sign, and her radiograph showed gradual improvement, making us reconsider lobectomy. Eventually, by the time it was about February 2015, her chest radiograph and the CT scan had dramatically improved, her cavitary lesions had almost healed, and we decided against the lobectomy because it seemed as if an adequate drug regimen alone would suffice. After about 22 months of therapy, with multiple cultures coming negative, she was finally declared cured, and we've been following her up since, and she's doing fine. The points that I would like to highlight in this case are that it's extremely important to think of resistance right from the word go, and therefore a molecular test like the GeneXpert, which detects resistance, is extremely important. If the expert test shows one to harbor a strain which is resistant to rifampicin, a line probe assay available in the public sector as well would be strongly recommended. It's also extremely important to notify such cases to the government, as it gives us a better hold of epidemiology and helps the program get better with time. A drug susceptibility test is invaluable in such a situation, and the results of the drug susceptibility test help us tailor the treatment to the individual pattern of resistance and ensures success in most cases. So as long as you get the diagnosis right, and as long as you treat or tailor the treatment to the individual, the probability of success is reasonably high.